How y'all doing today? This is Mr. Golf. I'm back at it. And the skills that we're going to be doing today is we're going to be doing Peri-Care. Got it? This is one of them stackable skills where we went from partial bed bath. Now we're going to do Peri-Care. So the first 10 steps that we did for partial bed bath is going to be the first 10 steps that we do for Peri-Care. Got it? The last 10 steps we did for partial bed bath is going to be the last 10 steps that we did for Peri-Care. So let me give you some important things you want to know about Peri-Care. With Peri-Care, you got to wash the front and the back. Got it? And when you do wash the front, good, you want to make sure you put a towel. Now, give you a good example. When you use a towel, you cannot take the towel and go frontwards up. What you have to do a log roll and move and place the towel behind the person, and then log roll the person onto the towel. You just can't stick the towel between the legs and move it up, okay? Second thing is, when it comes down to Peri-Care, you want to make sure you use 7 rags. 3 rags for the front, 3 rags for the back, and we can always keep an extra rag just for one fall. Got it? We're going to do wash, rinse, dry. Remember that equation for Peri-Care. Wash, rinse, dry. Got it? Peri-Care do not require for you to change the gown. Okay? Doesn't require for you to change the gown. That's another thing. But it do require that you do not overly expose the patient. So make sure you use one of your towels to cover the person's upper half, and make sure that you bring the sheet just to his knees. Got it? You could use what they call the tent method, or you could just bring the sheet to his knees. Let me show you what the tent method is. All you're doing is taking the legs and bring them like this, and then pulling it down as such. And what that do is allow you full access to deal with it, but it also kind of cuts off the access of people seeing in front of you, okay? The next thing you could do, the second method you could do is basically what I said, is when you are this is the second method you could use. One is the tent, where you actually bend the person's knees, and then the second one is just you laying the knees flat, and you covering the first half, and you cover the second where the knees is at. Got it? Any questions on that? If you got questions or comments, just put them at the bottom, and if I can, I will respond to them. Yeah. So let's get started. How you doing, Mr. Johnson? My name is Mr. Golf. I'll be your CNA today. Before I get started on your Peri-Care, I'm gonna go wash my hands, put my gloves on, provide privacy. Good. So I'll make sure my bed is supine. Good. I provide privacy. I grab my basin. Turn on the faucet. Check the temperature. Good, temperature good. Similarly, wash my hands, let it fill up to 3. Put on my gloves. Grab my paper towel. Paper towel's gone. Grab my paper towel. Turn off the faucet. Make sure it is at 3. Good. Then I immediately come in, take my basin directly to Miss Johnson, and then let them test the water. They say the water good. Place it here. Grab my 2 towels, my 6 rags. Remember, 6 rags plus 1. My soap. Good. I'm going to Put that right there. Because I'm rolling him towards me, I'm going to raise my rail, lift his arm up, and then I'm going to do a log roll. 1, 2, 3, and roll. I'm going to stuff and tuck. Good. Key thing is that you want to make sure that the towel covers the what? Mainly some of the back and some of the legs, but cover the 4 buttocks. Place that underneath, and then I'm gonna roll him back onto the towel. And now I'm going to bring that down. Place the towel above to cover him, and I can bring the sheets down to the kneecap. Now we have him ready, or have her ready to be washed. Good. When you are washing, it's the same technique. Wash, 1, flip my rag, 2, flip my rag, 3, flip my rag. So we're gonna do 1 stroke down, 1 stroke down, 1 stroke down. Remember, you do front to back when you are cleaning the front of the Peri-Care, and when you do the buttocks area, you do what? Back to front. So it's like a U. You go down and up, down and up. Got it? So I put soap on my rag. You want to have your rag nice and soapy. Have your rag nice and soapy. Good. And just 1, flip my rag. 2, flip my rag, and down the meatus. 3. I'm gonna do the same for my rinse. And I'm gonna do what? 1, flip my rag, 2, flip my rag, and then down the meatus. Good. I'm gonna do that same for my dry. And I'm gonna do what? 1, flip my rag, 2, flip my rag, and 3, right down the meatus. Good. Next thing I'm gonna do is cover her back up. Remove the towel. Place my towel right here, and then raise her arm to get that log roll back over. Have her reach across, and on the count of 1, 2, 3, we're gonna reach across. Good. Support her arm. Expose our buttocks area, and we're gonna take the towel. Place that over our backside, and we're gonna do the same 3 steps. We're gonna wet the rag, apply soap, making sure the soap is what? Soapy. Good. And then we're gonna do the same step. We're gonna go what? Back to front, 1, left cheek, 2, right. And then we're gonna find the sphincter, which is the anus area, and then we go from the anus all the way up to the back. Good. Do the same thing with my rinse rag. And we're gonna rinse left, right, and then last thing we're gonna rinse is between the buttocks, starting from the anus all the way up. Then we're gonna do the dry, same thing. Left, flip my rag, right, flip my rag, and right between the buttocks. Good. Once we do that, we can remove our towel. Place that here, remove our towel, and we're gonna log roll the patient back over. Good. Good. Now, back to the same steps. We're gonna take everything that we have. We can wipe the table off at this moment. We're gonna grab the soap, place in the soil linen, place that on the designated dirty area. We're gonna grab our basin. We're gonna dump paper towel, rinse, Dump. We're gonna take paper towels to dry. Place it in the designated dirty area. Do our 3-part step. Remove our gloves, capture, 2 fingers underneath. Dispose, simulate washing your hands, and then we're gonna go back into the room. We're gonna place call bell in hand. Make sure the bed is in the lowest position. Good. Release privacy. Document. Task complete. Again, partial bed bath, Peri-Care is a complete bed bath. It's just a complete bed bath broken down into 4 parts. Good. Just remember, all the steps is similar or to the same except for what you're actually doing. Thank you very much. See you in the next video.